There are a number of key recommendations that have been made for basic management of atopic dermatitis. I'm going to present things that came from the American Academy of Dermatology guidelines on the treatment of atopic dermatitis. One of the strongest recommendations was that moisturizers should be used, that they're an integral part of the treatment since there's strong evidence that their use can reduce disease severity and the need for drug management. This makes sense because these patients have dry skin and because we know that filaggrin mutations are important in the disease, and so barrier function is probably an issue for these patients. Bathing has been suggested as a part of treatment and maintenance, although there's no standard recommendations for the frequency or duration. And I've heard some dermatologists recommend lots of bathing to hydrate the skin, and others recommend less bathing to avoid removal of the natural oils in the skin. But either way, moisturizer should be applied after bathing to improve the skin hydration. Also, limiting the use of non-soap cleansers that are neutral to low pH, hypoallergenic, and fragrance-free may be sensible. You know, avoiding the use of detergent cleansers, which would strip the skin of its oils, would be, you know, a reasonable recommendation. And the addition of oils and other additives to bath water has not been recommended. There's not data to support it. And, you know, if you put oil in the bathtub, it doesn't mix with the water. It just sits on the surface anyway.